because while the Tablighi Jamaat the tracing becomes a major challenge, there's another debate that is brewing now within the medical community, and this is whether you should be wearing a mask or not. In the United States, the major doctor committee has now taken a U-turn and claimed that masks are essential. This even as the World Health Organization claims that only healthcare professionals need to wear masks. So what should you do? We break it down for you in this special report.
A global scramble for masks. This despite the official advice from the WHO not to wear them if you aren't sick and aren't caring for coronavirus patients or suspects. America's Center for Disease Control and Prevention is now likely to change the official guidance. The CDC is considering recommending do-it-yourself cloth coverings. You don't need surgical or medical grade masks. But homemade facial protection like many in India have now also begun to believe any mask is better protection than no mask at all. Dr S.B. Byotra of Delhi's Sri Gangaram Hospital endorses wearing homemade masks amid the pandemic.
We don't advise everybody to wear N95. N95, yes, especially we are taking a special precaution. People who are dealing with the patient, people in critical care, people in the casualties, people at home. You can take a normal cotton cloth, put 4 strings over there, and ladies can use their dupattas. We take our hanky, put over there. They will at least we can protect others from something. When we are coughing, our droplets will not go that far off.
Officially, though, India is still guarded about facial protection. The government's thrust remains on social distancing. Health authorities at the same time have indicated new guidelines may soon be issued about homemade masks.
हर लोगों को अवगत करना चाहते हैं कि मास्क सबको पहनने की जरूरत नहीं है. आपको मास्क से भी ज्यादा जरूरी है कि आप अपनी सोशल डिस्टेंसिंग 1 मीटर तक का डिस्टेंस रखें, और आपको अगर कभी खांसी और उस तरह से खुद हो तब आप मास्क पहनें.
Social distancing is indispensable in the fight against COVID-19. For people, masks serve as an additional physical barrier against infection.
Experts say that you don't need a N99 or N95 mask to protect yourself from those who may have developed symptoms of COVID or those who may be coughing, because the size of the virus is bigger. Hence, a normal cotton cloth or a normal covering for the mouth would also do.
Daily mask wearing is a social etiquette standard in East Asia. Japan, for example, produced more than 4 billion masks for private use alone in 2018. Some say it's probably Japan's mask culture that's helped the country slow the spread of coronavirus despite having multiple hotspots. India has no culture of mask wearing. But as the pandemic worsened, ordinary Indians have embraced the protection on their own. With Milind Sharma, Bureau Report, India Today.
Wear a mask or not is the next question I want to raise. I'm joined by one of the country's leading chest specialists, Dr. TS Kler, is Chairman PSRI Heart Institute. I appreciate your joining us, Doctor. This has become now an intense debate. You are having different doctors coming on this show and indeed across the world with different perspectives. What do you believe that face masks are in some way can cut down the chance of the disease being passed on? Is that a fair assumption to make, or they make no difference at all?
Yeah, Rajdeep, there is no doubt that mask is helpful, but the thing is that the mask must be used whenever you are going out of the house, you are going to any public place where there are people where distancing is not possible. But at the same time, I would certainly recommend that there is no need of N95 or better quality mask for average people, because those masks should be left for the medical personnel, because they are at a much higher risk to
So
get,
you're saying even
infection
ordinary
from the
masks are
COVID
fine, but use
patients.
it only when you're going outdoors. Suppose I'm going in the morning for a walk in the park. Should I be wearing my mask at a moment like this?
Yeah, I think so. When you are going out of the house, particularly where there are people, if there are no people, there is no need to wear a mask. When there is a people, in the vicinity, it is a good idea to wear mask. Even a routine surgical mask is good enough. I think we have a reasonable, good feeling, good evidence that covering the face with some kind of mask is better than using no mask at all.
The
But when
reason
you are
I'm asking you
inside,
this is
are, in
ICMR
the
has very
family,
clearly
you
said, Dr. ICMR has very clearly said that people who are not infected need not wear masks. On the other hand, we've seen in Japan, in South Korea, there's almost been a premium put on people wearing masks as often as possible.
I think the thing is that if we believe that the new study done in the Japan shows that there are two kinds of particles. One are heavy droplet particles, another are very, very thin particles. Those thin particles can stay in the environment for a long time. So I think in the interest of curtailing the epidemic, which can be very dangerous for a country like India, I would think that wearing a mask is better than not wearing a mask.
You know, I've got one study which says that there is a roughly 5-fold protection that a mask gives versus no barrier at all. There are other studies which do not seem to suggest that. So you're saying that on the balance of probability, if you can wear a mask, don't necessarily please don't wear an N95 mask. Leave that for the medical health professionals. Am I correct? Broadly, that's what you would suggest? That would be your recommendation?
That's right.
Okay.
That's right, Rajdeep. That is correct.
Okay. Doctor, I appreciate your joining us on the show tonight, telling us very clearly that only wear a face mask when you're when you're going out. B, you do not need to wear an N95 mask unless you are in close proximity to someone who's infected or you yourself have been infected at that moment. I appreciate, Doctor, you joining us on the show today.
Hello everyone, this is Rahul Kamal here. Hope you enjoyed this video. For the latest news and analysis, like and subscribe the India Today YouTube channel and don't forget to press the bell icon to stay updated.